You are taking an important step in treating your opioid dependence by taking Bunavail, buprenorphine and naloxone, buccal film. Bunavail is a prescription medicine indicated for maintenance treatment of opioid dependence and should be used as part of a complete treatment plan that includes counseling and psychosocial support. Along the road of life, you've turned the corner. Now keep going with Bunavail. Hi, my name is Matthew Sykes, and I want to welcome you to this important informational program for Bunavail patients. I've been a nurse practitioner since 1998, and though I suffered from alcohol and opioid dependence in the past, today I have over 5 years sobriety. So I understand the power of opioid addiction and what this road is like as you make your way back to the life you left, or forward to the life you want. One thing experience has taught me is that even the best resolve to change can be helped with the right medication. This is a moment of change for you, and I'm glad you're taking this time to learn more about taking Bunavail. The knowledge you take away can go a long way in helping you to get off to a good start. A few facts. Bunavail, buprenorphine and naloxone, buccal film, is indicated for maintenance treatment of opioid dependence. It is the first and only bi-layer buccal film for opioid dependence. Bunavail is known as a buccal film because it sticks to the inside of your cheek, which is called the buccal mucosa. Characteristics of Bunavail are that it's discreet, efficient, and easy to use. As you start your treatment with Bunavail, I want to share a bit about how opioids may affect your brain, and specifically how buprenorphine works to help treat your opioid dependence. Whether initially used recreationally or for medical treatment, opioid use can often lead to addiction. Opioids work by attaching to brain receptors, which can produce analgesia, euphoria, and respiratory depression. Long-term opioid use can actually cause chemical changes in the brain and may lead to withdrawal symptoms and cravings once opioid use is stopped. Bunavail contains buprenorphine, which is a medicine used to treat opioid dependence. Buprenorphine activates opioid receptors, but not to the same degree as full agonists. In this way, it helps to stop withdrawal symptoms and drug cravings. In addition, it blocks opioid full agonists, like methadone or heroin, from binding to the receptor and exerting their effects. If you're wondering whether you could become dependent on Bunavail, you should know that buprenorphine is also an opioid, and while it's different in some ways from heroin and many other opioids, it can still cause physical dependence. Ask your doctor about the difference between physical dependence and drug addiction, and please do not stop taking Bunavail without first talking to your doctor. It could cause you to become sick with uncomfortable withdrawal symptoms because your body has become used to this medicine. I hope you'll stay with this program all the way, as there is additional important safety information provided throughout. Now let's take a look at bioerodible mucoadhesive, or BEMA technology, the unique delivery system behind Bunavail, and how it works to support you in your therapy.
Here's how the novel BEMA bilayer buccal film works. The backing layer helps the medication flow to the cheek's mucous membrane and not back into the mouth to be swallowed. The dose of medication is printed on the mucoadhesive side to differentiate it from the backing layer. The mucoadhesive layer contains a dose of pre-dissolved medication. Its design allows it to adhere quickly to the inside of the cheek. BEMA buccal film adheres within seconds. Once it adheres, there's no need to continue holding it in place. It'll dissolve completely. Saliva moistens the mucoadhesive layer, causing it to adhere. The mucoadhesive layer bonds with the mucous membrane, keeping the buccal film in place. Then the medication is released. The backing layer helps facilitate one-way flow, so the medication is able to penetrate the mucous membrane and flow into the cheek's blood vessels. Now that the medication has entered the bloodstream, it is carried throughout the body by the circulatory system.
As you saw in that video, Bunavail's delivery system consists of a two-layer design. The top layer goes against your cheek and contains the buprenorphine, which is the same medicine that's in Suboxone. The second layer is the backing layer. The backing layer is there to help direct the buprenorphine into the cheek, where it's then absorbed into the bloodstream, rather than coming back into the mouth where it can be swallowed. Only Bunavail has this backing layer. These two layers work together, allowing Bunavail to administer the same amount of medicine into your bloodstream with a lower overall dose as compared with Suboxone. As a result of this design, Bunavail provides the same blood level of buprenorphine as the corresponding dose of Suboxone, but with less medicine left over than can be swallowed. The other characteristic you may have noticed is that Bunavail is discreet. You can place the film against your cheek, and once it's there, you can immediately begin to interact with other people and talk and swallow normally. So you may not feel the need to isolate yourself from others while the film dissolves. A couple other points about Bunavail. In a 12-week study of patients that were switched from Suboxone tablets or films to Bunavail, 8 out of 10 patients rated Bunavail as very easy, or neutral to use. And 9 out of 10 patients considered the mild citrus flavor of Bunavail very pleasant, or neutral. Another thing you may want to know is that in that same study, there was a 68% reduction in reports of constipation after switching from Suboxone to Bunavail. During the study, 2.8% of patients developed new or worsening constipation. Of course, Bunavail is just one important part of a complete treatment program, which should include counseling, medication therapy, and other remedies. Bunavail buccal film has twice the bioavailability of Suboxone tablets. Bioavailability refers to the amount of an administered drug that enters the bloodstream. Bunavail has twice the bioavailability of Suboxone tablets, which means you get the same amount of buprenorphine in your bloodstream, but with half the total dose. Bunavail is currently available in 3 dosages. Whether you're switching from Suboxone tablets or films, the corresponding Suboxone dose is shown here for your reference. Your doctor will decide which Bunavail dose is right for you, but here are a few guidelines. Always take Bunavail exactly as your doctor tells you. Your doctor may change your dose after seeing how it affects you. Do not change your dose unless your doctor tells you to change it. Do not take Bunavail more or less often than prescribed by your doctor. You may be prescribed 2 or more Bunavail films to be taken at the same time. Use the entire Bunavail buccal film. Do not cut, tear, chew, or swallow the buccal film. Your doctor should show you how to use Bunavail the right way. Follow the same instructions every time you take a dose of Bunavail buccal film. Bunavail comes in a child-resistant foil package. Do not open the foil package until you are ready to use the Bunavail buccal film. After opening the foil package, use the Bunavail buccal film right away. Now, let's take a closer look at how to take Bunavail.
My name's Charlie, and I've been in recovery for a while now. Getting up for work every morning. I do it for me, my wife, and the child we're having. I've been on buprenorphine medication. I've tried others, but now I'm taking Bunavail, and it's working well for me. Take the Bunavail foil packet and look at the back, and you'll see the dotted lines. And you'll see there's tiny incisions on it. Fold the wrapper along the dotted line and tear down along the incision. Then just tear down along the other incision and pry it open slowly. You can just pull it right open. Once you get it open, you'll see the medication, a square yellow film. It's flexible and kind of see-through. You want to make sure the writing is facing you, and also make sure your mouth has some moisture in it. Slowly put the film right against the middle of your cheek, with the writing facing your cheek, and you want to lightly press, very lightly press, and try not to let it hit your teeth. I would count 5 seconds in your head. Pull away, and it'll attach to your cheek. And even if I put 2 in my mouth, I do the same thing for each side, just placing the second film on the other cheek, and it'll stay right there, and the medicine gets absorbed into your cheek. As it dissolves, it might feel kind of gummy, but that's normal. Just let it dissolve on its own. Try not to play with it with your tongue. Expect it to take a little while to fully dissolve, but during that time, you can talk, swallow when you need to, and for me, it doesn't taste bad. I can do what I have to, like my morning routine, go to my group therapy session, or just be with my wife and not let it get in the way. I can take Bunavail and you just wouldn't know.
Well, that may look pretty easy, but as the saying goes, practice makes perfect. So don't be shy about asking your doctor for drug-free practice samples so you can get used to applying Bunavail buccal film. Okay, so now that you know how to use Bunavail, you need to remember to take it as prescribed. So it's a good idea to think of memorable ways to work it into your daily routine. Here are a few. Keep Bunavail in a place associated with other routines, as long as it is out of sight and reach of children. Program automatic reminders on your phone so you can take it at the same time each day. Ask a friend or family member to remind you. Please refer to the instructions on your product package for proper storage procedures. It's fine if you need to go somewhere and take your Bunavail dosage with you, but please be mindful of the package instructions. For eligible patients, the Bunavail Savings Card can help lower your out-of-pocket costs for your medication. To see if you qualify for a Bunavail Savings Card, talk with your healthcare provider or visit BunavailSavingsCard.com. An important part of ensuring Bunavail is working for you is to make sure you are using it safely. There are some medicines you'll want to avoid while taking Bunavail. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Bunavail may affect the way other medicines work, and other medicines may affect how Bunavail works. Some medicines may cause serious or life-threatening medical problems when taken with Bunavail. If you are pregnant or breastfeeding, before taking Bunavail, tell your doctor if you are pregnant or plan to become pregnant. If you become pregnant while taking Bunavail, tell your doctor immediately, as there may be significant risks to you and your baby. Your baby may have symptoms of withdrawal at birth. Before taking Bunavail, talk to your doctor if you are breastfeeding or plan to breastfeed your baby. Bunavail can pass into your breast milk and may harm your baby. Monitor your baby for increased sleepiness and breathing problems. Your doctor should tell you about the best way to feed your baby if you are taking Bunavail. Bunavail is not recommended in patients with severe hepatic impairment. Bunavail may be used with caution for maintenance treatment in patients with moderate hepatic impairment. Common side effects of Bunavail include headache, drug withdrawal syndrome, lethargy or lack of energy, sweating, constipation, decrease in sleep or insomnia, fatigue, sleepiness. Call your doctor for medical advice about side effects. This is not a complete list of potential adverse events associated with Bunavail. To report negative side effects associated with taking Bunavail buccal film, please call 1-800-469-0261. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit fda.gov/medwatch or call 1-800-FDA-1088. Note that Bunavail can be abused in a manner similar to other opioids, legal or illicit. Keep Bunavail in a safe place. Do not give your Bunavail to other people. It can cause them harm or even death. Selling or giving away this medicine is against the law. How is Bunavail different from other buprenorphine medications like Suboxone? Bunavail contains buprenorphine, the same medicine found in other medications designed for the treatment of opioid dependence. Unlike some medications you may take, Bunavail does not go under your tongue. It is the only medication that uses special film technology to stick to the inside of your cheek to deliver buprenorphine. It's discreet, so no one knows you're taking it, and you can speak and swallow normally as it dissolves. The unique technology in Bunavail includes a backing layer, which helps to direct medication into your bloodstream and stop it from flowing back into your mouth where you might swallow it. In fact, with Bunavail, you get the same amount of medication as you do with Suboxone, but from a smaller total dose. The relative bioavailability of Bunavail to Suboxone was determined through a pharmacologic comparison with Suboxone tablets. The doses of Bunavail are less than what I'm used to getting. Does that mean I'm getting less medication? Bunavail has about half the overall dose of Suboxone because its unique route of administration and two-layer design allows it to deliver buprenorphine more efficiently. The same amount of buprenorphine gets into your bloodstream through your cheek and less flows back into your mouth where it could be swallowed. As a result, Bunavail can have a lower dose while giving you the same amount of buprenorphine as Suboxone. Which side of the film should I place against my cheek? The side with the dose strength, BN4 printed on it, should be placed against your cheek. This side is designed to stick to your cheek when it comes into contact with moisture and deliver buprenorphine as it dissolves. If you place the wrong side of the film against your cheek, Bunavail will not stick. Can I cut my Bunavail film? Use the entire film to make sure you get the amount of medicine you need. You should not cut, tear, chew, or swallow the film. Take Bunavail as prescribed by your doctor. Is my film supposed to feel gummy after it has started to dissolve? Some patients say that Bunavail film feels sticky or gummy as it dissolves. This can be considered normal and is due to the materials in Bunavail that cause it to stick to the inside of your cheek and efficiently deliver buprenorphine into the bloodstream. How long does Bunavail take to dissolve? Bunavail begins to dissolve as soon as it's placed against the cheek. The time it takes to dissolve varies by person. You should leave it in your mouth until it's fully dissolved. During this time, you can speak and swallow normally and interact with others without them knowing you're taking your medication. The Bunavail film is made of 2 layers, each with a different thickness. The backing layer is thicker than the top layer, and since it's thicker, it will take more time to dissolve. This design allows the backing layer to stop some of the buprenorphine from flowing back into your mouth where it can be swallowed. Can I eat and drink while taking Bunavail? Can I smoke? You can speak and swallow normally while taking Bunavail. However, you shouldn't eat or drink, as that may cause the film to come off your cheek before it's fully dissolved. Do not drink alcohol while using Bunavail, as this can lead to loss of consciousness or even death. There are no restrictions regarding smoking when taking Bunavail. How long do I have to take Bunavail? Bunavail is a maintenance medication. That means it should be taken on a regular basis for the treatment of opioid dependence. Work with your doctor on coming up with a treatment plan that's right for you. Make sure you take Bunavail as prescribed by your doctor. What should I do if I still have cravings or think I may be experiencing withdrawal symptoms? Continue to take your medication as prescribed and call your doctor to discuss your symptoms. Is a film on my cheek going to irritate my mouth? In a scientific study, 249 people who took Suboxone switched to Bunavail for 12 weeks. Before they switched to Bunavail, up to 6.8% of people had oral abnormalities over 2 examinations. During the 12 weeks of the study, researchers conducted more than 1,000 examinations of people's mouths. They found that 2.4% of people had an oral abnormality, but no abnormalities were seen in the last 4 weeks of the study. If you do have any side effects, call your doctor right away. Are there any programs to help me pay for my medication? The Bunavail Savings Program is available to help eligible patients pay for their medication. Whether you have commercial insurance or are paying cash for your medication, the Bunavail Savings Program can help reduce the cost of your medication. Visit BunavailSavingsCard.com for more information and to print a card. Thank you for taking the time to listen in on this program. I hope the information helps put you on a positive course as you switch to Bunavail therapy. I can tell you from experience, you've turned the corner. Now just keep going.